We're going to cover the dead bug. This is an exercise for your anterior core. It's going to work on bringing that rib cage down over top and more of a neutral relationship to your pelvis. So we're going to start on your back here. Key point is we're not going to push your back into the floor. We do bend the knees to start because it does take a little bit of extension out of your lower back, but we're not going to push your lumbar spine or your low back into the floor. The way we're actually going to bring your back into the floor is we're going to focus on breathing. So by doing that, we're going to take your rib cage and bring it further down to be matched on top of your pelvis, kind of in a more of a neutral alignment here versus being extended here. So to do that, Kelsey here is going to take a big breath out or push most of the air out of her lungs. As she breathes all the way out, she's going to feel these ribs here kind of drop down this way. As best she can, she's going to hold those there, and then she's going to take as best as she can a big breath into her belly, kind of where my thumbs are, trying to push those apart. She's going to hold that, and then she's going to lift both knees off of the floor here. And from there, she's going to take a few breaths in and out, trying to maintain that pressure right above that hip bone, kind of in this hip crease. Sometimes you can place your hands here, and squeeze with your fingers and your thumb, and you should feel that expansion kind of go this way as you do that. The next step in the exercise is to continue to breathe as best we can, and she's going to slowly lower, keeping a knee bent. She's going to slowly lower one leg down, tapping the heel, trying not to feel any loss of pressure on that same side as the leg that moves. From there, she can cycle back and forth. The goal would be to continue to breathe comfortably and only perform the exercise or the reps as long as she continues to kind of maintain a good breath in that position.